today we're going to talk about the 7 key pillars of health to maximize your pet's health and the holistic pet health and longevity method. So I want to share with you a lot of information, and welcome again to this masterclass where you will learn a lot. And for those who don't know me, I'm Dr. Odette Suter. I'm a holistic veterinarian, and I help pet parents such as yourselves achieve better health for your beloved companions. So I'm going to start right away with sharing the strategy, because that's what I'm going to talk about during this whole session. But I always start out with asking this: are you happy with the results that you're currently getting from your animal's health care? Is your animal's health where you would like it to be? Feel free to drop a little answer into the chat box about that. I already saw some people talk about allergies and GI issues and things like that, and cancer. So I would assume that some of you probably are really wanting to know more about all of that and how to help your animals. So when I ask this question, more often than not, the answer is no, for obvious reasons, because people don't usually come to me unless their animals have already some health issues present. Although it would certainly be a lot more preferable if people showed up ahead of time, and so that I can help them keep their animals healthy to begin with. So today we're going to talk about how we can do things differently, because we really need to do things differently if we want to get different results. So today I will give you the strategy that I use in my practice to support my animal patients, to support their healing, and also to optimize their health. So basically, the strategy is the 7 pillars, and pillar number 1 is diet. Pillar number 2 is the digestive system. And then we also want to work on detoxification. We want to make sure that the communication system of the body is working properly, and that would be the nervous system. Hormones are also crucial for health. We also want to look at that. Fitness and exercise, one of the most undervalued, beneficial wonder drugs for our animals and ourselves. And then last but not least, we also need to look at emotional and mental health, because all of these different things have a huge impact on the animals and are necessary for an animal to be healthy. So this is the strategy that I want to talk to you about today. So this is going to be a value-packed masterclass. So I recommend that you turn off all distractions, turn off your phones, hide them so you don't have to look at them, close the doors if somebody is pulling on you, because I really want you to get all that information. It's such crucial information for your animals' lives, for you to truly understand that. But make no mistake, this is for you just as much as it is for your animals, because these principles that I will share with you are really applying to people just as much. Basically, they apply to every living being, really, on to some degree in any case. So anyways, lots of information here. And I figure that you're watching this masterclass because your animal is showing some symptoms and you would really like to get rid of those. And if that's the case, then what I really need to show you tonight is that the symptoms that your animal is currently exhibiting is merely a sign that it is losing its health. And that's why a lot of times when we have multiple symptoms going on at the same time. So for example, if an animal has allergies, we may also see weight gain, lack of energy, recurrent infections, etc. And if we don't do something differently, we're going to just end up with the same results over and over again. So if I can show you why it is that the treatments that you've tried haven't worked, or have only worked as long as your animals were on strong drugs that created side effects, would you say, I would like an opportunity to do something about that? So today I'm going to talk to you about disease and what it really is, because that's something that we didn't even address in vet school. Like the really, really basic fundamentals that we absolutely have to understand are not talked about, and most people are not aware of it. And it's really simple and very logical. You'll see, I'll go into those. And then we'll also talk a little bit about the common denominator for disease. And then I also want to talk to you about the cause of poor health. And then again, more diving into the strategy. So I really want you to understand all of these things, because that's really very important. And, you know, as much as we think that there are different diseases out there that are completely different and unrelated, hence the many Facebook groups, they have much more in common than what we're taught. And that is why the strategy that I will be sharing with you today can be applied to every single body, no matter what's ailing it, with a little bit of tweaking, of course. But for the most part, it really applies to every single body. And in fact, I also use this strategy on a daily basis to keep my own body functioning at its highest potential as well. So we're going to dive into these essential fundamentals that hardly anybody is teaching. Just to get started, I want to just have a look at some chronic diseases in pets, just so that we have a little bit of numbers here. So Banfield, they usually do a state of health pet report every year. So they basically pool all the information from the different vet hospitals that they have, and then put the numbers together and put out a report. And this one report they did in 2011 was pooling numbers from 2006 to 2011. And that was really a very eye-opening report that basically showed that a lot of chronic diseases have significantly increased, such as diabetes in dogs and cats. Dental diseases have significantly increased, arthritis in particular in cats, and obesity is skyrocketing, especially in cats as well. But certainly we see it in dogs too, because today over half of pets are actually overweight. And when we look at cancer, there's definitely been a change in that as well. And we have numbers that show that 1 in 3 dogs will develop tumors during their lifetime. 45% of dogs that are older than 10 years of age will die of cancer. And cancer accounts for nearly 50% of all disease-related pet deaths each year. So it's the leading cause of death right now. And then if we look at this graph here, we can also see how the numbers of cancer incidence was relatively low in, what was that, like 30 years ago or so? And now it has significantly increased. In fact, there's been a 2.3-fold increase in those 17 years. And the report or the numbers stop at 2000. So what happened in the last 20 years? We don't really have numbers for that. So all the numbers that you see are actually already 2 decades old. So things have changed. But obviously, when we look at this graph here, we can see that there is a big kink here happening. So it was slowly increasing, and then all of a sudden it was going up a whole lot more. And I did a little bit of digging to see what was going on at the same time. And in 1994, right around that time, that's when GMO products hit the stores. And with GMO also comes glyphosate, which is the active ingredient of Roundup. And so since that came on the market, we've seen an incidence of cancer increase that has definitely skyrocketed, if you want, because it's pretty sad what's happening. When it comes to allergies, dogs and cats are affected as well. 10 to 20% of the population worldwide is suffering from allergies. I'm not sure that these numbers are really accurate, because it seems that sometimes during certain periods of time in my practice, all I see is allergies. So I'm not sure that these numbers are correct, but certainly allergies are a huge problem as well. When it comes to healthcare, there's a lot of wrong and lacking information out there. So most of what you will actually find out there is really not accurate. So let me ask you this. Do you feel like we have enough information out there? Is that information, as I said, is it true, that we're presented with? Is it confusing? Is it hard to come by? When I talk to people, oftentimes what they will tell me is that there is enough information, but it's really confusing because there are so many sides of the same story. In addition, a lot of information that is presented to us is also purely marketing. So, for example, if I start this sentence, I'm pretty sure you guys will be able to complete it. So, milk, it does ... I'll let you think. It does a body good, right? You've probably heard that one. So who came up with that one? Was it the healthcare industry? No, it was the dairy industry. They want to make money, so it's really just marketing. It's pure marketing. And so we need to be a little bit more discerning, but sometimes it's really hard to wade through all this information because there's money attached to it. Prescription foods, oftentimes there's the natural, pure joint health added to it or extra omega-3s. So it all sounds good on the bag, right? But then whatever might be in it may not actually be all that healthy. And I'm talking about the conventional field and marketing, but there's also a lot of marketing happening in the holistic field as well. And that's also why a lot of people end up bringing me bags of supplements when they come for their first visit, because the marketing strategies are working quite well in the holistic field as well. So as you will see as we continue on, that's really not necessarily the way to go. We humans also have a bit of a problem and tend to put things on the back burner until it hits us big time. No pain, no gain, right? Unfortunately, when it comes to health, that's not really a good strategy. And sometimes we just don't even know what to look for or don't even recognize what's wrong until the cup overflows. And I see that quite a lot, where people just come in and they're like a little shell shocked because all of a sudden their dog has cancer or allergies or IBD or whatever it may be. So oftentimes it just kind of hits us over the head, which is really sad. But, the fact that you're here tells me that you're ready for change or at least curious about what you can do for your animals. But whether you're going to actually take action today will really determine their health from now on, because you need to understand that whatever you have done up until now has determined their health up until now. But how it's going to be tomorrow, the next week, and the next years really depends on what you do from now on. And so we really need to do something differently if we want to have different results. And I'm repeating that over and over again, I know, because we try to do the same thing over and over again because we don't really have other solutions. So today I'm going to show you some solutions so that you can get out of that. So where are you now with your pets as far as their health is concerned? Jot down just a little bit what's ailing your pets. Some of you have already done that, and what your challenges are, and also where you want to go from here regarding their health. What is your goal? Write it down on a little piece of paper for yourselves as well. This is where I'm at right now today with my animals, and this is where I'd like to go, because you will see that I will help to bridge that gap a little bit, at least with some information, so that you have a bit more information on where to go from here. But we can't talk about health without also talking about the healthcare system. And as many probably know, the American healthcare system is ranked at the bottom of all developed countries. But not only that, we also spend more money on healthcare than any other country. And that really goes for animals as well. And unfortunately, that money generally does not translate into health, that money that we spend. Furthermore, the World Health Organization also says that the majority of all diseases prevalent today are not treatable with orthodox medical procedures. Wow. And I think they said that a long time ago, but it certainly is still true. And the British Medical Journal also did a little bit of research, and they found that 85% of all medical procedures and surgeries are not scientifically proven. So not only do we have a healthcare system that only works for a small percentage of diseases, and 85% of these procedures aren't even proven. So basically, where does that leave us really with our animals? Do drugs and surgery correct the underlying cause, or do they merely cover up symptoms? In other words, do you think that animals are having allergies, for example, because they're lacking prednisone in their body? Or do we get headaches because we are deficient in Tylenol? So you need to understand that there is an underlying cause, and that underlying cause is not addressed by our current healthcare system. And that's why only a small percentage of all issues can really be treated by our conventional healthcare system, and the rest really needs a different approach. And that's what we're going to talk about. So I'm asking you again, are you happy with the results that you're currently getting from your animal's healthcare? So most pet parents, they go from vet to vet with no lasting improvements of their animal's health because they're only given band-aids rather than uncovering the root cause. It leaves them wasting precious time and money with their pets while their pets continue to suffer. In desperation, they resort to becoming their own pet's vet by trying to put the pieces together through online research. And this again is not just about conventional medicine. I also see that very much so in the holistic field, where band-aids are being used by trying herbs, trying, different things, but not really putting the pieces together. So this goes for the holistic field as well. Oftentimes I will get people who tell me that they've already tried everything. And then when I start asking, well, what that everything is, it was a whole lot of different supplements, but there was really no plan. So empowered pet parents, they have discovered the root cause of disease and learned what is needed to restore and maintain health. They have become proactive in their pets' healthcare and have gained a deeper understanding of how the body works. They use a proven method and their pets experience a happier and healthier life. So settle in and stick around if you've tried everything and your pet is still not feeling well. And please don't feel bad, because we certainly do live in an environment where things are just a lot more challenging these days. So we're all on a steep learning curve. Also stick around if you've exhausted all that conventional medicine has to offer and want to explore a more holistic approach to health. Or if you feel overwhelmed by all the information available and don't know where to start. You enjoy having a mentor and be part of a loving, supportive community. You wish to start your puppy or kitten on a path of health and be proactive. And you want to become a troublemaker and shake up the veterinary profession. And I have put, I always have a smile on my face when I say that, because I like to cause trouble. Because the change is coming from you guys. It's not going to come from the veterinary community. So the more you are troublemakers, and, in a nice way, of course, the more that will shake up the veterinary profession. And we really need that, well, not just for veterinary profession, and many other areas of life as well. And if you want to be an educated client and support your vet, because nowadays we do have some deficiencies in veterinarians and veterinary staff. And so the more educated you are, the easier you're making it on your veterinarians as well, because you can already do a lot of things yourself and you have some of the answers already. And so that takes away some of that burden that we veterinarians have sometimes. And then also, if you're ready for change, and if you work in the animal field and would like to better support your clients and customers. So stick around if that describes you. Now, this class is not for everyone. I'm very well aware of it, but I still encourage you to stay, because this information may someday come in handy. But feel free to leave if you're looking for a quick fix and natural band-aids, because that's certainly not what I'm going to be sharing with you. If you're not really interested in new ideas and change, that's also not for you. You think you've learned everything there is about holistic medicine. If you're stuck in a limited or negative mindset, that's not for you either. And you only gather information but don't take action. And I also want to be very upfront with you guys. I want to be transparent and tell you right now that I will make you an offer at the end for an exclusive opportunity to work with me. But I will give you 45 minutes of the strategy that has helped hundreds of animals. And I hope you'll stay until the end, because no matter what, you will gain important information to help your pets. And at the end of the class, I will invite you to apply for the Holistic Pet Health and Longevity Method program. So just be aware of that, because I'm super excited to welcome you into the program if you're fit, of course, because my sole mission on this planet is really to improve the quality of health of all of our animal friends, and by supporting you and also empower you with the knowledge that is needed to create a beautiful, healthy, long life for your furry companions. I want to see more smiles. but I just want people to be happy. So stay until the end for the Q&A. But before we really dive in, I want to share with you a little bit about my history and what qualifies me to deliver this health-changing information. I've been a holistic veterinarian for 27 years, but it was my parents who really already primed me for a natural approach to life early on. We had our own organic garden, and my mother would make some really nasty tasting herbal concoctions when I was sick. But that also taught me to honor and care for all living beings, including our planet Earth. And even before vet school, I supported the animals in my care through unconventional ways. I was never really satisfied with the status quo and always asked questions that made my teachers really nervous. And as you can imagine, my professors in vet school didn't particularly welcome that because I was asking these really fundamental questions and they didn't really have the answers to that. So thankfully, though, along the way, I met many people who kept bursting my little bubble with new thought-provoking and life-altering information. Like one of the people I used to trim hooves while I was at vet school to make a little money on the side. And one of the ladies had a psychic figure something out about her pony. And I'm like, yeah, right. But I figured, well, what do I have to lose? Let's just stay open. And well, I was proven wrong, and it really helped that pony. So staying open has been kind of my mantra ever since then, because, we miss things otherwise. But anyways, being off to a good start, sadly, didn't really result in good health for me, because I had a lot of stressors in my life, including my mother's passing, the intensity of vet school, and then also the challenges of stepping into the world as a veterinarian. That all really took a toll on me. And I became quite sick with chronic fatigue syndrome, and my couch sadly became my best friend for nearly a decade. So for many years, I had zero energy, and I just literally felt like I was dying. In that time, of course, I devoured a lot of information and tried many different modalities in the attempt to heal myself. I left no stone unturned, and with each stone, I learned a tremendous amount. But what really pulled me through this difficult time was my strong belief that if my body breaks, I should be able to fix it. I had many mentors on the way. They taught me to be open, courageous, and brave, and they taught me that healing comes from leaping into the unknown. And I know that sounds scary, and believe me, I've had a lot of fears along the way, but it always paid off to kind of go past that, not be reckless, of course, but, go a little beyond that and go into the more uncomfortable space. So my stubbornness, or my persistence, as I call it, came in really handy. I was 100% committed to curing my body. But my healing story didn't finish with my recovery from chronic fatigue syndrome. Years later, unfortunately, I had a pony that stepped on my shoulders and knocked me over, and I ended up with a whole lot of pain radiating down my arms from a slipped disc. And at that point, I really needed some drugs because the pain was excruciating. I mean, every time I tried to turn in bed, I just wanted to scream. And that was a big piece of humble pie that I got at that point, because I really needed to have that experience of the excruciating pain, because I was so closed off to conventional medicine and really in desperate need of integrating both worlds. But unfortunately, because of the drugs that I was put on, I ended up with an autoimmune disease. And that took a little while to recover from as well. But thankfully, by that time, I had discovered what it takes, that it takes a system and a methodical approach to restore function and heal. And so it only took me 2 years to fully recover and be in better health than ever. And that was maybe 8 years ago, and I have had zero autoimmune anything since then. So basically what I'm telling you is I can relate to you and your animals, because I suffered from 2 debilitating diseases that most people never recover from. I see many animals with chronic conditions that considerably impact not only their lives, but also that of their caregivers. And because of my own journey and what it put me through, I was forced to examine and question and learn, change, and grow. My body taught me more than vet school could ever have, and made me the veterinarian that I am today. So my experience gave me the knowledge and the humility it takes to help my patients and their families. And most of all, I discovered the key to true healing. It takes all pieces of the puzzle to create a whole. So this is why I'm so excited about sharing this method with you, because it truly changed my life, and it helped hundreds of my patients go from really poor quality of life to enjoying vibrant health. And these are just a couple of testimonials from a couple of patients who have gone through that process with me. Rhonda says, we were so fortunate to find Dr. Suter. We had been trying for over a year to help our dog. She was only 2 years old, but was acting like a 15-year-old dog. She only wanted to lay around and sleep. Her former vet offered no help, and after a year and repeated cost on tests, they gave us no hope. I found Odette, and after just the first visit, there was a huge improvement with our pup. She continued being treated on a 6-month health restart program, and she is now 5 years old and more active than her 2-year-old sister. The learning sessions with the program were so informational on the continued health of both of our pets. We are thankful every day for having found Odette and her treatment program. It literally gave us our dog back to live a full, happy life. And I'm going to share that with you. But her husband also started to get on the program himself. You know, he was kind of doing his own thing that way, but he was basically copying what we were doing with the dogs. And he also got a lot better from that. So obviously I didn't work with him directly because I'm a veterinarian and not an MD, but still it was really neat to see that he actually took that information to heart and applied it to his own body as well. And Jessica, I cannot say enough great things about Dr. Odette Suter. Several years ago, one of my dogs was in agony with allergies. We had tried everything, so we thought, and the vets we had taken him to had been pumping him full of meds which weren't working. His skin was swollen, red, and bleeding from all the scratching he was doing. In desperation, I Googled holistic vets in our area, and that's how I found Odette. I liked her from the moment we met her. She is warm, caring, gentle, and just excellent with all of our animals. Our 3 dogs adore her. She was able to get our dog's allergies under control so he could live a happy life again. It's just heartwarming, you know, when that happens. And Michael, he said that Dr. Suter is the best there is. Well, I don't know about that, but she has been unbelievable with my dog the past couple of months and has been able to restore her health. I highly recommend Dr. Suter to anyone who loves their animal. And that was his dog who had a lot of GI issues. And Jill, she had a couple of dogs with some significant health issues as well. One of them had some seizure problems after a rabies vaccine. So she wrote, prior to meeting Dr. Suter, we were living in fear of our dog's illnesses, back and forth to specialist vets with more and more medication. After only 3 months of working with Dr. Suter, our dogs have remarkable health improvements. Specifically, our dog rarely wagged his tail and was very anxious. He's now a happy, healthy, calm boy. Clear eyes, wonderful demeanor, and wagging his tail constantly. So you can see it is possible if we apply this method. So are you ready to do the same for your pets? Put a little yes in the chat box. I want to know if you guys are ready. I'm really excited. And also, by having this method at your fingertips, imagine where your furry friends and you could be in just 1 year. You know, dare to dream, because it's a little bit about hope too. Oftentimes when our animals are so sick, we lose hope. And so I want to reinstill a little bit of hope, a little bit of a light at the end of the tunnel. So what I'm going to share with you, consider this a little bit of your shortcut, because I don't want you to spend a decade trying to fix your animal's health. I don't want you to waste precious time and money. Plus, truth be told, your animals don't really have a decade because they don't really live that long. So don't do what I did, trying a little bit of something here and there without really having a system. So I want to show you this shortcut that I accumulated over these years of painful suffering and vegetating. Sometimes it's hard to not see it as a waste of time, but the learning that came from it was just really incredible. So no pain, no gain, right? So let's dive in and look at the fundamentals that hardly anyone is teaching. And fundamentals are really important. So I want you to pay really close attention. So As a holistic veterinarian, when I see an animal, I ask two very important and very simple questions. The first one is, if the animal's body isn't functioning properly, what is it missing? And the second question is, if the animal's body isn't functioning properly, what might be interfering with that function? And those are really simple questions and logical questions that most of us really ask in almost every other aspect of life, right? So if I show you this wilting plant right here, what is your first thought? Well, maybe it needs a little bit of water, right? What about a little bit of sunshine? Probably would help as well. And then what might be interfering with this plant? Maybe it has bugs or some toxins, or somebody poured some gasoline on it instead of water, right? So this is very logical thinking, and that's how most people think, and that's what I do when I look at health. So let me explain really quickly though. 27 years ago, when I graduated from vet school, I used what I learned back then. I already had a little bit of holistic training, but now after 27 years, or during that time of becoming who I am today, I let go of a lot of things that I learned back then. I mean, I still have it in my mind and integrated, but a lot of it is really not all that useful anymore when it comes to chronic diseases. And that's what we're mostly dealing with these days. So what I do now is I practice functional medicine. Have you guys heard of functional medicine? Do you know what it is? Well, it's really simple. It's applying natural things to help your animal's body function better. Now, what happens if your animal's body functions better? Its health will improve, right? So let me tell you just a little something about health improving that most people really don't know about. When an animal is healing allergies, for example, it is at the same time also healing obesity, recurrent infections, lack of energy, whatever else might be going on at the same time. So when the body heals, it really heals everything all at once. And that's because the principles that cause the body to heal are all the same. Now, can drugs really do that? No way, right? If you have to give drugs, the drugs will last for a certain period of time. And during that time, the symptoms of your animals might go away. But what happens when you stop the drugs? Well, the symptoms will come right back. So if you're giving drugs, you have to basically give them every day. And that is really very similar to going to a mechanic with your car because your car engine light is on. But all the mechanic does is he resets the light and then sends you on your way. So what happens when you drive off? Well, the car engine light will come right back on, right? So wouldn't that make you a little bit furious if your mechanic were to do that to you? But that's really what we do with the conventional healthcare system and also with the natural healthcare system to some degree. That's what we do to our animals. I'm not asking you to take your animals off drugs. Please don't do that. And I'm also not here to bash the conventional medical system because it certainly has its place. In fact, it's really good for any sort of crisis situations. So for example, if your dog or cat or horse has a life-threatening emergency, you certainly want to have that system available. You want to have that help because it can take care of things immediately. The problem is that using that system to regain health and to rebuild the body afterwards, that's not really what it's for. So the conventional system is a bit more like firemen. They come into your house when your house is burning. So you want them to come and extinguish the fire with their strong water hoses. But then once the fire is extinguished, are you going to ask them to come back with their water hoses to repair your house? No, because that would just create more destruction. So you really want to work with someone that knows how to rebuild the house afterwards. You want a carpenter. And that's where holistic medicine really comes in. And that's what I do. I teach you how to rebuild your animal's health because I understand the principles that it takes to rebuild health. And those are the principles that I will share with you in this masterclass. But sadly, that's really not how our healthcare system functions. Do you know what the number one website is that people consult? Generally, it is WebMD. And with WebMD, what they do, they put a symptom in because WebMD has a symptom tracker. And so they put the symptom in, and then it tells them, what drug they need. So it doesn't really ask about anything else. So if you look at this dog here, what might the first thought be? What medical condition does this dog have? Well, obviously he's got some skin issues. So what would be the second thought that most people have is, what drugs or supplements do they need to fix that? And that's where the error in thinking happens. But that's our conventional healthcare system. And it has kind of bled over to the holistic system as well, because I see a lot of so-called holistic medicine that is approached the same way, basically. And pharmaceutical companies, they really spend billions of dollars per year to make you think that way. In the case of this dog, what could be the first thought? Well, what shampoo can we use to help with this condition? That's really not the way to go, because we really need to find out what is going on. We need to find out the basics. We need to go beyond a pill for every ill. We need to ask questions, because the problem got there because either the body was missing something or something was interfering with the body's function. So we need to go back to these two initial questions that I asked, because that's where the answer really lies. So in the conventional system, a disease equals prescription drugs for life. And with this wrong and lacking information, we think that if we have a sick animal and we give it a pill, then it will be healthy again. And oftentimes this pill can also be substituted for supplements, because again, when a dog, for example, is slower, a lot of people will think, oh, it has joint issues, it has arthritis, I need to give it some joint supplements, where in fact, it's just a little bit of a misalignment in the spine that is affecting the nerves. And there's a little bit of pain as a result of that, possibly. And if we fix that, then the animal is fine again. And I see that all the time. Actually, I had 3 of those this last week that came in for some slowing down, getting older, where they left feeling so much better after just a little bit of an adjustment. So we really need to figure out the underlying cause. And when we look at the underlying cause, we have to look at what is the common denominator that we see most of the time these days. And that common denominator of disease is inflammation. There's a lot of talk about inflammation these days, and oftentimes we have this chronic underlying inflammation that we don't see. It's a little bit like a volcano that hasn't erupted yet, but it's sort of bubbling under the surface. And then all of a sudden, when the body can't compensate anymore, we start to see symptoms. And that's when the volcano erupts. And inflammation is really a good thing. For example, if your animal hits itself somewhere, we want to make sure that that area will heal. But then once that healing is done, the inflammation needs to be gone as well. But if we have chronic inflammation going on, it will continuously destroy the body and affect the body, because inflammation, part of the inflammatory process is to destroy and to eat up things. And so if that continuously goes on, that will then affect the organs and the body in general. So we certainly don't want to have that inflammation going on all the time, because that's when it becomes a really bad thing, and it can also turn deadly. So inflammation can be good in the acute phase, but if we have chronic inflammation going on, it's really bad. And there are a lot of diseases that we're familiar with that are the result of this chronic inflammation, including cancer, cardiovascular issues, IBD, which is an inflammatory bowel disease, renal disease, arthritis, autoimmune disease, pancreatitis, diabetes. I mean, those are just a few of those that can be attributed to chronic inflammation. So a lot of what we see nowadays has at the base chronic inflammation, and that causes damage to the body. So chronic inflammation is really inflammation that has run amok, and it's at the root of all chronic illness. And the chronic smoldering inflammation will destroy our organs and our ability to function optimally. And again, that goes for us as well as for our pets. So what causes this chronic inflammation? Poor diet certainly affected, toxins, hormone imbalances, gut issues, vaccines, drugs, including preventatives, excess fat, because fat doesn't just sit there and do nothing. It actually is metabolically active. lack of exercise, stress, etc. So all of these cause inflammation, and I want to look at some of those a little bit more closely with you. So let's just start a little bit with the liver here. So this big blob right here, that's the liver. And you can see that toxins are being taken up into the liver, and they get converted through phase 1 and phase 2 into a waste that is more water soluble, and that is then removed from the body through the gallbladder and then dumped into the GI tract and out the poop chute. And then it also goes through the kidneys and the urine. So that's how the toxins move through the liver. And the liver needs all of these different nutrients here in order for these two phases to occur properly. And I'm obviously not asking you to memorize all of these, but these are just some of the nutrients that they need for the liver to function efficiently. So if the liver gets overwhelmed by toxins, which is often the case nowadays, it can really not do all of the steps that it needs to do to get rid of these toxins. So if we feed our dogs or our cats a diet that is deficient in certain ones of these nutrients, then the liver cannot really do its job properly. So diet is really important for the liver to be able to function properly, and the liver is important to detoxify the body. So if we have a deficiency in nutrients and we have an excess, so the deficiency and excess play a role here, then we have issues and we have disease as a result. Closely tied in with the liver is the thyroid hormone, and I picked the thyroid gland as an example because the thyroid hormones are really essential to all function of the body. And the thyroid gland is located right next to the trachea on both sides of the throat area for both dogs, cats, horses, humans, for everybody. And the thyroid produces T4, and then it converts into T3 in the liver. So the liver is really important again here. And T4 is the inactive form of that thyroid hormone, whereas T3 is the active form. So T4 is a little bit like crude oil that needs to be converted into gasoline so that it can be used in your car. But we also have a little bit of conversion happening in the peripheral tissue, and so in other tissues, and then also some of the conversion is happening in the gastrointestinal tract. So in order for the thyroid metabolism to work properly, we have to have a well-functioning liver. So everything is really tightly connected, as you can see right there. And then to take it a little bit further, the cells also need to be able to respond to the thyroid hormone. And unfortunately, when cells are inflamed, their membranes aren't functioning well, and the receptors for these thyroid hormones are not really working well enough. So basically, then the cell doesn't really get the information. So it's a little bit like taking gasoline and pouring it over your car instead of into your gas tank. So if you pour it over your car, nothing much is going to happen except it's going to really smell bad. So the cells are a little bit the same. If they can't really take up that thyroid hormone, no matter how much thyroid hormone is there, if they don't respond, nothing is going to happen. And a lack of thyroid hormone function, on all levels, actually then results in all of the cells functioning at a slower speed. And that's a bit like trying to bake a cake at 100 degrees. Nothing is going to happen with that. So the same for the body. If the thyroid hormone is lacking and the cells are not functioning at the speed that they should, there's some accumulation of waste, and then they get sicker and sicker. So it's very important that we have enough of these hormones. And this doesn't apply just to the thyroid hormone. It goes for insulin, leptin, estrogen, progesterone, all the other hormones as well. So it's very important that all of that function properly. All right, and then of course we also have the gastrointestinal tract. That is also a very important part that plays a huge role in the disease process for animals. And if the gastrointestinal tract isn't functioning properly, nothing else really is either. So let's have just a little closer look. And I'm sure that you guys have all heard the phrase, no guts, no glory, right? So if the gut isn't working properly, then the entire body will have issues, including the skin, the brain, teeth, etc. And I want to explain to you why that is. So this section right here that you see, these are all cells, and they are supposed to be really closely connected, and they line the interior of these gastrointestinal loops. So the layer on the inside of the GI loops is just one layer thick. And so when we have inflammation in the gastrointestinal tract, what happens is that these cells separate from each other and basically create a little bit of space between them. And we call that leaky gut. So normally they would be really tightly connected without any holes in between. But when we have inflammation and things that affect the gastrointestinal tract, such as drugs and stress and toxins, etc., and pathogens, then these tight junctions between the cells loosen up, and then we can have particles that go through between these cells and go into the bloodstream. And normally, whatever these particles are, they get digested and then they go through the cell, not between the cells. So they are then small enough and are processed well enough to then go into the bloodstream and be useful. So when we have this leaky gut going on, of course, we have these particles that go through that are not properly digested, and the body doesn't really know what to do with those. And as a result, we end up with nutrient malabsorption. So basically a deficiency because the digestive tract is not breaking down things well enough. But we can also end up with autoimmunity because anytime we have these big particles floating around in the bloodstream, the immune system comes running and tries to clean it up. And when the immune system comes running, guess what happens? We have inflammation, right? That's what the immune system is good for. It creates inflammation. And because these particles are in the blood and they circulate with the blood, the inflammation goes body-wide as a result, including the brain. So that's how this inflammation gets transferred everywhere. And some of these particles that are not properly digested, they look very similar to what the body itself is made of. A perfect example of that is gluten. So gluten, the protein gluten, looks very similar to what the thyroid gland is made of. So if the body is reacting to gluten, the immune system will recognize gluten, it will have a memory, oh, this is what gluten looks like, and then it kind of floats around, and then it goes through the thyroid, and it goes, wait a minute, that protein looks exactly the same as that gluten over there that I just attacked, so let me attack that as well. And that's how we end up with autoimmune thyroiditis, especially in humans. But that can also be something, for example, from like a kidney particle or some other kind of protein, and the body recognizes it and then starts to attack its own body. But we can also end up with food intolerance because the immune system will start reacting towards these particles that are coming in. And anytime we have a breach of this gut lining here, we also have a blood-brain barrier breach because the blood-brain barrier has also just that one layer of cells. So when that gets breached, then things get into the brain that shouldn't, and then we end up with inflammation in the brain, and inflammation in the brain is never a good thing because that can lead to Alzheimer's, Parkinson's, dementia, cognitive dysfunction, anxiety, aggression, all of those types of things. So not a good thing. And then just in general, that systemic inflammation. So basically, if we have problems with the gut here, we have problems everywhere. And that is not something that we want. I see that all the time. Patients come to me, they all have some form of leaky gut going on. It's something that is so common. And in fact, with all animals that come to see me, I always assume that they have some degree of GI inflammation, just because we also live in an environment that's very stressful, lots of toxins, drugs, pathogens, etc., that are floating around. So that's just an assumption I make, and then I work on that. And of course, as the poop lady, I can't not mention the microbiome, which is basically the microbial community that lives in and around the body. And just to let you know, it's imperative to wear this hat when you're doing a fecal transplant. Otherwise, it's not going to work because, it brings some smiles on everybody's face. So that always helps to make things work better. But anyway, so the microbial community is what lives in and around the body, and that can be bacteria, viruses, protozoa, parasites, any number of microbes. And they outnumber the body's cells by a factor of 10. And genetically, they outnumber the body by a factor of 150. And there are hundreds of different species, and they code for 90% of all metabolic processes. And there are 200,000 microbes per immune cell. So they're really the first line of defense. So who is running the show here? It's the microbes, right? So if you don't learn anything else from this lecture tonight, is to ask the two questions about deficiency and excess, but also to make friends with microbes, because they are the ones that are saving our lives. They're the ones that are making things happening. And unfortunately, with the practices that we have on this planet with trying to kill everything, we have had a decrease in diversity by about 50%, which that is unfortunately not a good thing. So the microbiome is very important. And just from a gut perspective in general, there's a lot of research that's being done to find what the connection is between the gut and the brain. And the scientists have found that if there's a little problem in the gut, usually the brain will make a mountain out of it by the time the information goes north, basically. So I want to just demonstrate that by talking to you about a patient of mine who came in with inflammatory bowel disease. He had had diarrhea for about 3 years and lots of anxiety. We did a lot for him to help heal his gastrointestinal tract. And as a result, his diarrhea obviously went away, but his anxiety left as well. And he was able to come back to normal. So I see that all the time. And another patient that will illustrate a little bit why I just do gut healing procedures on every dog that comes in. So another patient of mine, he didn't really have any gut issues, and he also seemed to be quite healthy, but the owner had signed up for the program, so we went through all of this. So we switched him to an anti-inflammatory diet and also did a fecal transplant and some detox. And lo and behold, the dog, who had always been a little bit shy and had been tucking his head when somebody wanted to pet him, stopped doing that. His whole attitude changed. He became much more outgoing and much more assertive toward the other dog in the family. So just because you don't necessarily see symptoms there, it doesn't mean that your animal is 100% healthy, because a lot of them, they will certainly try to hide things. So anyways, there was a big change in this dog just by switching the diet and getting a little bit of inflammation out of his body, even though he was really considered a healthy dog. And this patient is a real example that the volcano hadn't erupted yet, but it was bubbling underneath. And had we waited longer, who knows what would have happened. So it really makes sense to take care of things before they actually get out of hand. And the fact is that today we all need this kind of support in order to stay healthy, because we're exposed to so many toxins and suffer from nutrient depletion due to soils being deficient in nutrients from the farming practices that we're utilizing. So you might ask, where are these toxins coming from? Food is one place. You wouldn't believe what kinds of stuff they put in food these days. We have a lot of toxins that come through water. Water is actually now been called polypharmacy, because everybody's antidepressants and whatever other drugs they're on ends up in the water. So if you have depression, just drink city water and you get your antidepressant that way. GMOs, of course, bring with them a lot of spraying of pesticides and herbicides and fertilizers, and then a lot of cleaning products and body products. Humans, women and men, use, I can't remember what the number was, but like 70 to 100 different chemicals they put on their bodies every day. And guess where that will end up? Well, on your dog or cat, because if you go and pet them with all these chemicals on you, they will get some of that as well. And then, of course, air pollution, geoengineering, drugs, preventatives, vaccines are all toxic sources. And then some of the unseen toxins, such as electromagnetic radiation from Wi-Fi, cell towers, cell phones, etc., all the smart devices. And then the body's metabolism itself creates toxins. And if it can't really get rid of the toxins, then it will accumulate them. Because, of course, this dog is significantly overweight and is like full of inflammation. So it's a very toxic dog. And then stress, obviously, also contributes significantly. The current situation when it comes to toxicity, when we look at how it was yesterday versus today, we can really see why it is that our bodies are struggling so much. And I'm sure you guys have seen it. Oh, maybe you had a childhood dog who lived into their early 20s or something without a problem and eating kibble its whole life. Whereas today you have a golden retriever who can barely make it to 7 without being significantly ill. So things have changed significantly. This graph actually shows that we're exposed to more chemicals than ever before. So in the 1940s or so, they were using about 1 million kilograms every year in the US. And now we're at more than 200 plus billion kilograms of chemicals that are used every year. And more than 1.5 million new chemicals have been put on the market since World War II. And most of them are carcinogenic and have never been tested for. Some of them are also interfering with hormones. We call them xenoestrogens because they mimic estrogens. And those are why we have so many male amphibians that are now turning into females, for example, or girls that are getting their periods at 5 years of age. So they really wreak havoc with our bodies. And how can we expect the body to really be able to deal with that? You know, the body's detoxification system was not designed to deal with this kind of onslaught of toxicity. And so we really need to support the body's detox organs if we want to keep our animals healthy. So now that we've talked about a few aspects that really affect the body and really damage the body and make it impossible for the body to be healthy, we want to look at the solution. And that solution is the 7 pillars of health. So let me ask you, after what I explained to you so far, do you feel like you can really predict the future of your animal's health? Well, I hope you said yes. At least to some extent, we can. But there are a lot of mistakes that I see, and that's what I want to talk to you about a little bit more just right here, because we need to have a good plan. First, we need to test. When anything is going wrong, we want to figure out what is the underlying cause, what is really going on. We don't want to just guess. So a very simple example, again, a dog can't jump into the car as easily as it could. So wouldn't you want to test first and know what's really going on before jumping to treatment, which in many cases is joint supplements, for example. So we forget to ask the in-between, the why, and figure out what's going on. So we want to determine the underlying cause, the true underlying cause. And we want to focus on that cause and not the symptoms. And we want to correct that dysfunction and not just alter labs with drugs, which is also something that conventional medicine often will do. So we want to focus on the cause, but of course, if an animal has a lot of pain, a lot of discomfort, quality of life isn't good, we do want to help them with their symptoms. I mean, that goes without saying. And then we want to address the body as a whole and use a systematic approach. And that's really, really important. And that was the biggest mistake I made when I had chronic fatigue syndrome. I wasn't using a systematic approach. I was doing a little bit of something here, a little bit of something there. You know, I read a little something online that this herb may help. So I tried that. And then I read something else that might help. And that was really what slowed down the process of healing, which, you know, ultimately led me to figure out the systematic approach. But I want to save you guys some of that heartache and that pain and also the cost of it, because let's just say it was a little expensive, the whole thing. So we want to have a systematic approach, and I highly recommend having some mentoring, you know, whether it's me or someone else, just somebody who knows how to use a systematic approach to bring your animals back to health. That is so important. The fact is that most failure is really just due to not having a system. It's not that an herb isn't good or something isn't good. It's just that we don't have a system. We don't have all the pieces together. So I want to get back to the strategy. What are these missing pieces? Well, number one is diet. And I will look at all of those a little bit more deeply with you. Just want to repeat them real quick so that you see them all. So pillar number one would be diet. Pillar number two, healing the gastrointestinal tract. Pillar number three, detoxification. Pillar number four, nervous system, and then we have the hormones, fitness and exercise, and emotional and mental health. So when we look at nutrition, we obviously want to feed them a diet to provide them with the essential nutrients for optimal cell function, because we want all of these cells in the body to function properly. And as we mentioned earlier, a lot of times there is deficiency of nutrients because the soil is not as good as it was, so food just aren't as rich as they used to be. So deficiency. And then we can also have excess by feeding a diet that is highly inflammatory, like a lot of these kibble foods, because they are very high in carbohydrates, and carbohydrates cause a lot of inflammation in the body. So step number one is always to feed a species appropriate diet that is designed for individual needs, because every dog or cat is going to be a little bit different as far as what their needs are concerned. You know, an older dog may not tolerate a raw diet as well as a young dog, so we have to be a little careful and discerning on that. But the fresher the food is that we feed, and the more it is what they would eat in the wild, the more healthy they can be, because the body is basically made to be processing that type of food, so minimally processed. And food either heals or harms. We just need to keep that in mind. And then we want to heal the digestive tract, because as Hippocrates, who lived 400 BC, already knew, all diseases begin in the gut. So we want to remove offending foods and treat chronic infections. We want to add some digestive aids, such as enzymes. And then we want to rebalance the microbiome. I use a lot of fecal transplants that way because it just gives you the biggest bang for your buck. And it provides a whole microbiome versus probiotics. They only have a few species in them. And from what I mentioned before, the many species there are in the microbiome, you can never really make up for a deficiency there with a probiotic. And we also want to help repair the gut lining. And then once these two are in place, we can start detoxifying the body. But we want to make sure that diet and the gastrointestinal tract are all set, because we don't want to start detoxifying the body without that, because otherwise we will just mobilize toxins in the body of your animals, and then as a result they will actually feel sicker. So we want to make sure that we provide the nutrients necessary for the liver. Remember, the liver blob well, we needed all these nutrients, so we want to provide that. And we also want to make sure that the toxins can go out by making sure that your animals are pooping on a regular basis. But there's a lot of things that you can already do ahead of that. You can limit toxins that you have control over. So your cleaning supplies, have a look at the label. If there's something on the label that you don't know what it is, I recommend switching it out for something else. At least that's my policy. If I go into a store and I need something, I look at the label. If I don't know what it is, I'm like, that's probably not healthy. So that's my way. So you can limit exposure. You can stop spraying your yard for mosquitoes and all sorts of other things. You can just clean up your own environment much more. And that will also help you, of course, as well. And then choose non-toxic alternatives. Also limit the exposure to toxic drugs and preventatives and vaccines. And then certainly providing clean water, decreasing electromagnetic radiation. So at least turn off your Wi-Fi at night, or when you leave the house. You don't really need that. And then I also recommend doing biannual cleansing, because we are exposed to so many toxins that we really need to support the liver to do its job. And then the nervous system, that is really something that needs lifelong maintenance. I highly recommend that starting really early, because every part of the body receives nerve input from the brain and also talks back to the brain. And if that communication isn't working properly, then there's an issue. So for example, if an animal has a little bit of pain in the back, and as a result can't move its hind legs as well, then we want to make sure that we fix that, because if we don't, then eventually the spine will start to become arthritic, and then it will start to impinge on the spinal cord that goes through that spinal canal. And as a result, the nerves then cannot communicate very well to the hind end, and that can then result in urinary incontinence and also fecal incontinence, for example. And then obviously weakness, which in a big dog, that's not all that great for your own back. So we want to make sure that works properly. And I remember a cat that had some kidney failure going on, and I did just a little bit of a chiropractic adjustment for the cat to improve nerve input into the kidney. And the next day, this cat's urine puddle was much smaller than it was normally. So it had really helped to improve kidney function. The nervous system obviously also relies heavily on the gut. We have that gut-brain axis, and the brain is very sensitive to inflammation, so we want to make sure that we decrease inflammation so that it doesn't deteriorate, because in people they have found that some of these neurodegenerative diseases actually start up to 30 years before symptoms even occur. So when it comes to brain health, we want to start out young. Low carb diet, because that's anti-inflammatory and the brain really prefers fat for fuel anyway. You snooze, you lose definitely applies to the brain. So if they don't get enough exercise, that will also affect brain health. And then we want to make sure that the hormones are in good shape as well. All aspects of life are really affected by these hormones, including behavior. So a lot of animals that are returned to the pound, oftentimes they have behavior issues that could easily be fixed if the hormones were looked at. So when in doubt, test the levels. We can support them with glandular supplements. We can decrease stress, which will also help. We can improve communication between hormone glands. And that is something that I do with chiropractic manual therapy oftentimes. And then we can aid the metabolism and detoxification, because all of these hormone glands also are very much affected by toxins. So detoxification will also free up the hormone glands to work better. And it will also free up the cells to have a better membrane and be more responsive to the hormones when they attach to the receptors. And then fitness and exercise is really crucial to preserve mobility, balance, and is also essential for mental stimulation. So the less exercise an animal gets, the more likely they are to end up with dementia or cognitive dysfunction later in life, because the less the brain is stimulated to do something, the more it will start to shrink. Fitness and exercise are really key to longevity. They are key to maintaining joint health. It also helps to release endorphins and they feel better. So it helps with anxiety issues as well. And it's just fun. But basically, exercise is really the closest thing to a wonder drug, according to Aaron E. Carroll, which I would fully agree with that. Because when I look around, the people in my life who exercise a lot and work hard, are physically active, they tend to live longer. And then emotional health and stress management is certainly very important. And that really applies to us humans, because animals do sense our stress. They basically take on some of our stress. So the more stressed we are, the more we're affecting them. And again, we are all humans. We all have stress, especially more recent years. It's been a little bit more accelerated, the change on this planet. So that creates more stress. But we definitely want to work on stress management. And stress can come from physical stress. So if the body is not healthy, that is stressful to the body. Mental and emotional stress also will affect their health. And we need to address that. We also want to create a safe environment, also communicating with them. For example, if you have to leave, you have to go out of town or whatever it may be, tell them where you're going, what you're going to do, when you're going to be back, who's going to take care of them. Just basically tell them everything that's going to happen so that they can be prepared for that. And there are a lot of herbs and supplements that can be used, including ashwagandha, CBD oil, etc. But again, we want to look at the whole picture and not just focus on just one thing. So basically, putting the pieces together is really important, because the whole is greater than the sum of its parts. That was really the key learning that I got from my own illness, is that I need to put all the pieces together. And that's really what is necessary. And if my patients do that, my clients do that for their animals, then usually they get better faster than if they don't. So something that I want you to consider is learning about health is like learning to fly a plane. Would you do this on your own by watching videos or reading a book about it, or asking random people on Facebook, which I see all the time, drives me crazy, because most of these people are not really that educated. So in any case, I hope that you're not going to try to learn to fly a plane by yourself, because that would be a little hazardous to, well, you and everybody who may be below you, if you can even get it to take off. But in any case, the same is really true for healing. And as doctors, it is really our duty to teach, because doctor means teacher in Latin. And so I really want to teach you, and that's why I created this program, so that I can fill the gaps and that you can really truly be empowered in your animal's health. Because as veterinarians, when we see patients on a daily basis, we don't have the time to teach as much as we would like to. And that's really why I created this, is to help fill some of these holes. Because again, healing is easier and faster with a mentor that can guide you. So just a few things to keep in mind. Even though I had a healthy upbringing and thought I was doing everything right, I still got sick. It took me about 10 years to heal my chronic fatigue syndrome. And had I known then what I have discovered through countless hours of research and tens of thousands of dollars spent, I would have suffered a lot less. And as I mentioned earlier, our animals don't have the luxury of time, especially nowadays. Your pets really need the solution now. And this is just an example. Here again, this is Dakota. That was before. She was 20 pounds overweight, no energy, and had this really typical sad face of a dog who's hypothyroid. So she didn't have enough thyroid hormone. And that was after she got all slim and sassy and happy. So you can see a huge difference, and her face looks so much happier. And this is another one. This is Nico. He suffered from food sensitivities that caused him to have awful chronic ear and skin issues. You can't really see the ears, but this is like this big blotch that he had on his belly. He also suffered from bouts of very painful pancreatitis and ended up in the hospital several times, which is expensive and obviously painful. But with diet change, gut healing, and hormonal support, he became a sweet and happy cat again. And this here is Grit. A huge thanks to Dr. Suter. I brought home this wonderful, intelligent little puppy, and within the first year, he was slipping away from me. I knew he did not feel well, but his symptoms did not seem connected. His feet would bleed. He had pimple-like sores on his torso. He was obsessed with licking up urine and eating lots of dirt, lack of focus, and very sensitive to any touch. Within a few weeks, Dr. Suter found out exactly what was going on with him and got him on the proper protocol. It was life-changing for both of us, as he became the dog I knew that he could be, and I was so thankful that he was finally feeling great and wanting to do things. Dr. Suter gave my dog back to me, and Grit and I are forever grateful. Yeah, I get emails every so often on how well he's doing. It's just really beautiful. So this is not just a theory, and until now I've been sharing this system more so with my one-on-one patients like Grit, Dakota, and Nico, but I have tested this entire system and proven its result, not only with my own body, but also with the many animal patients that I've treated. At this point, with the increased need for support and significant veterinary shortage, especially in the holistic arena, I know I can make a greater impact by sharing it with more people, such as yourselves, which is why I'm here today with you. So this method is time-tested and proven, and to this day, I'm using this method in my practice. In fact, I also continue using these strategies on my own body. So if you're thinking, I'm ready, where do I start? All you have to do is commit and take action, which you're already doing by showing up today for this masterclass and sticking with it. So I gave you a small peek into my entire holistic health and longevity strategy, but as I'm sure you can imagine, this is just the tip of the iceberg when it comes to taking your furry companion's health to a new level, optimizing their body's function and preventing disease by implementing these 7 pillars of health. So you have 2 options. You can either do it yourself, do all the research until your brain explodes, or you can take a proven success path. And if you decide to work with me, nothing will be held back, no missing steps. You will just need to follow my lead step by step. I'm on a mission to empower you to take your animal's health into your own hands, to remove the headaches and teach you the exact process to care for your animals in a truly holistic way. that helps to optimize their body's function. And that's what my holistic pet health and longevity method includes. I have taken the entire process from start to finish to support your pets to live a long and happy life through guidance on how to optimize their diet, heal their digestive system, create a safer internal and external environment to reduce toxic load, so that you can set your fur family up for a healthy life and proactively support them into their senior years. I put all of this into my program through lectures, Q&A sessions, and the support of a like-minded community. And I'm a truly holistic veterinarian. So why would you want to sign up? The biggest issue I see in the holistic animal health space is there is so much information out there, each place only teaching a piece of the puzzle essential to creating greater health for your animals. And that's why many people struggle with how to integrate holistic and conventional veterinary advice and how to communicate with their veterinarians efficiently. Not having a clear plan and getting advice from different Facebook groups and lay people, for example, is very confusing. Only addressing one pillar of health is like trying to build a house with only one wall that can never be a house. And trying to manage symptoms with natural remedies, which truly is only marginally better than using conventional medicine, because it's still not addressing the underlying cause. And I see that all the time. So I wanted you to have the best possible launch pad for a healthy and happy life for your beloved companions, because I've been through it and I'm coming at this with years of experience experimenting and finding the things that actually work long-term versus just trends. And this one is another very perfect example. Oliver was suffering from a very painful autoimmune condition that attacks the muscles used for chewing. And when he came to see me, the only option was to increase the steroid dosage even further to keep him comfortable. So I did a little bit of testing with him, and it revealed that his thyroid levels were quite low. He also suffered from food sensitivity and had a significant imbalance in his microbiome. So what we did is we eliminated the offending foods that were causing inflammation in the gut. We did a fecal transplant. We put him on some thyroid medication. I also assisted him with some Chinese herbs and weekly acupuncture and chiropractic work. And based on that, he was starting to come out of hiding, which was really beautiful. He was able to open his mouth wider again. He was able to pick up his ball to play, and they were able to actually decrease his steroid levels. And, unfortunately for me, he became a lot more feisty and difficult to treat, but, that's a good problem to have, right? Not only with my personal patients, one-on-one like that, but I also have been able to make a deep impact via my teaching. Mary is one of the people in my program here. She said, "Learned so much. Thank you. This program is priceless. Dr. Suter, you're a gift to us who want to do the very best for our four-legged loves. Thank you for sharing your wealth of knowledge with all of us. I, for one, will be grateful forever." If you are on the fence about joining the Holistic Pet Health and Longevity Program, jump off that fence and sharpen your pencil. You are in for an informative ride. We have such a wonderful group, like-minded pet parents from all over the globe. Dr. Suter takes hard topics and breaks them down so that you can easily understand them, and she makes them fun too. The Q&A sessions, which are live every week, are so informative too. I'm so glad I took the leap. Our pup's vitality has truly improved since taking this course. You have everything to gain. Enjoy. And Michelle says, "I've seen multiple improvements in my pack since starting the program." She has 15 dogs. Digestive issues have resolved, seasonal allergy issues are under control, and overall my dogs are a lot healthier. It has been such a wonderful experience to find like-minded people to share ideas and information with, and to have a safe space to ask questions and have discussions. I love the Q&A sessions and always learn something new from the other community members' questions. Most of all, the guidance and support from Dr. Suter has been invaluable, and I'm incredibly grateful to have found her and this program. And it's actually quite mutual there. So I have amazing people in my group. Basically, the people I would like to work with, my dream pet parent for the program wants to do everything in their power to optimize their pet's health, takes action and makes changes, is a student at heart and enjoys learning, understands that this is an investment in their pet's health, loves to be part of the village and support others in their journey, and is also ready to be challenged and also keep me on my toes. So are you next? Well, the better we fit together, the better the results. So this is my service in this world, and I want to help pet parents who really want to learn and want to change. So if that's you, that's what you get. You get 9 modules with 36 plus expert lessons. I do Q&As live on a weekly basis, 2 of those actually. And then you also have access to the like-minded, loving community that will help to support you. And then there are some PDFs and other support documents that you get access to as well. And this is all for a lifetime. So one time, you pay for it and you have it for life. And the weekly Q&As, they are ongoing until I'm not alive anymore, I guess. So who is this for? It's for pet parents, trainers, pet store owners, animal communicators, breeders, pet health coaches, and also for veterinarians and vet nurses who want to branch out into the holistic arena. It's for pet families who have tried everything and are tired of watching their animals suffer and wish to learn how to create a long and healthy life for their furry companions. It's for those who understand that investing in your animal's health is the only way to truly heal and not stay stuck on the treadmill of chasing symptoms with Band-Aids. And it's also for people who are action takers and who are actually going to implement the information. So if this sounds like you, you're invited to sign up for an interview to see if you're a good fit to enroll in my holistic pet health and longevity program. I have set aside time in the next few days to talk to you and see if I can help. The call is approximately 45 minutes, and the intention is to understand your challenges around your pet's healthcare and your goals for your companions, and also to identify how and if we are a good fit to work together inside of the program. So if you want in, you can book a call. I have set aside some time to do all these interviews. I can only handle about 6 a day. So I recommend applying sooner than later if you are interested. And of course, as the saying goes, an ounce of prevention is worth a pound of cure. And it is so true when it comes to health. What you invest will pay you back in dividend of joy and laughter, fun, and of course, health for years to come. So I always tell people, you either pay now or you pay later. And the cost later is always much higher because it also involves a lot of emotional and other types of pain that comes along with that. So highly recommend that. So here's what I know to be true. I would not be here today without investing in working with the people who were there when I needed them, who were mentoring me. So where do you want to be in a year? So if you're interested, I invite you to book a call. I would certainly love to work with you guys. All right, so I'm going to get out of the share here and look at some of the questions. I know a lot of people have posted some questions in the Q&A. Thank you so much, you guys, for hanging in there. All right, so Kit, you asked, what's the difference between homeopathy and holistic? So homeopathy is an actual, approach to medicine. Kind of like Chinese medicine, for example, is its separate thing. I mean, it's part of the holistic, but it's just one aspect. And homeopathy is basically where they take supplements and dilute them down, or herbs, dilute them down so much until there's nothing left in there except for the energy of it. And they give it that way. And with homeopathy, the way the treatment is done is you basically treat the disease with what would cause the disease, but it's so diluted that it then helps stimulate the body to get rid of it. I hope that makes sense. So for example, in Cuba, they used homeopathy a lot with people who have leptospirosis. So they had an outbreak of leptospirosis, which is can be deadly. And so what they did is they used homeopathy for that. So they diluted, they took the leptospirus bacterium, diluted it down so much that there was really no bacterium left, but just the energy. And then they gave that to the people, and they got better from that. So that's how homeopathy works. So it's just one aspect, and there are some holistic vets that use homeopathy in their practice, but it's a very well, it's a subject matter that requires a lot of study. So not all holistic vets do homeopathy. Holistic really is more of like a broad overall use of a term that just encompasses the whole body, but there are different modalities that are used in the holistic field depending on what people are drawn to use or learn. I hope that makes sense. And then, how long can you give milk thistle? Can it cause issues if given too long? Well, I always like to do things, based on what I just talked about, and not just necessarily randomly give something for a long period of time. I want to make sure that the body really needs it, because everything that we give, no matter how natural it is, it can have potentially, have potential side effects. So I always like to give it maybe for 3-4 weeks and then give a break. But it depends a little bit on the animal. Again, it's not like a rule. It really kind of depends on what's going on with the animal. All right, Robin, my 15-year-old kitty has intermittent loose stools, sometimes hairballs, motility issues. I've tried a lot of supplements. He has been raw fed his entire life and never had a vaccine. He was diagnosed with hypertrophic cardiomyopathy in 2020. He is happy and loving and enjoys his life every day. He lost his brother to a saddle thrombus 2 weeks before he was diagnosed, which is how we found out he had hypertrophic cardiomyopathy. I would probably, in those cases, I'd like to start out with some chiropractic work just to make sure that the nervous system is working properly, because if the nervous system is not providing enough information into the gastrointestinal tract, then everything can be slowed down, and that can then result in hairballs and loose stool and things like that. But certainly also looking at the microbiome, there are some tests that you can do from Animal Biome. They have a test kit that they can send out to you, and then you can check to see what what kind of microbiome imbalance there is, and then you can work on that. Certainly would look there, and potentially doing a food sensitivity test with NutriScan is certainly also a possibility, especially if it's something that's been going on for a long time. It might be worth checking to see if there's some food sensitivity happening as well. Is VetriShield Plus safe for heartworm prevention? I give it in summer, warmer months only. I'm in New Jersey. I'm not familiar with VetriShield Plus. I would assume it's a regular heartworm preventative. If it is, there are a lot of brands out there, so I'm not familiar with all of them, but usually with most preventatives, if there's a plus attached to it, it also will deworm the animal every month. So I generally prefer to go with a non-plus version, because I don't think that is necessary. Plus, these preventatives also affect the microbiome, so definitely, I prefer to just go with a non-plus version of a heartworm preventative. Okay, Allison, for my dog with cancer mast cells, she's going through chemo, taking Palladia, prednisone, antihistamines. She also had stereotactic radiation on the tumor and lymph nodes. About a month prior to tumor showing up, she had been eating poop. I was about to do animal biome test, but then cancer happened. Her prognosis is good with aggressive therapy. She still tries to eat poop. When can I test the microbiome? After all the chemotherapy ends next April? Well, I would probably work with a holistic vet on that as well, because there are certainly other types of things that we can also do as far as antihistamines are concerned. And then I would work on supporting the gastrointestinal tract already, because that is important for the entire for the entire body to function properly, including the immune system. And when there's cancer, there's always a little bit of issues with the immune system as well. So I probably wouldn't wait that long. But of course, the problem is that when they are on chemo drugs, these chemotherapeutic agents, they can also affect the microbiome. So yeah, it's a bit of a tough call, that one. But certainly I would probably do something to support the gut, even if it is just giving your dog like a fecal transplant, fecal capsule once a day. Obviously not at the same time as Palladia, but maybe kind of 12 hours apart, just to give the microbiome a little boost every day. So that certainly could be an option. And then JA, hi, 16-year-old cat was diagnosed with IBD 2 years ago. She has been on a raw diet and pre-probiotics since then. Wow, that's awesome. Because, transitioning a cat to raw, that's always a bit of a challenge. But we are having such a hard time tapering him off of prednisone. Every time we try to taper from 2.5 milligrams daily, he needs to be hospitalized for anorexia and vomiting. He also suffers from a severe constipation. What supplements can help him to get him off the steroids and have quality of life? We've tried Adored Beast, Apothecary, Leaky Gut Protocol, and all he did was vomit while taking the Gut Soothe and Liver Tonic. I would certainly do a fecal test, check to see if there are parasites, because sometimes they are a little hidden and may not always show up. So I don't know if they did any sort of anti-parasitic treatment at some point. Definitely looking at the biome, looking to see if there's food sensitivity. Those would be the tests that I would certainly run. I also like to check IgA levels, which is an immunoglobulin. If you Google Plechner's syndrome, I will put that in the chat here for you. Plechner's syndrome. You can read a little bit more about that. Let me see. So 2.5 milligrams of prednisolone, that would be 10 milligrams. Okay. Yeah. So those would be the things to start, because you want to find the underlying cause why he has IBD, because IBD basically is inflammatory bowel disease. So it basically tells you there's inflammation in the gut, but why? It doesn't tell you why. So that's kind of the biggest issue I find around IBD is oftentimes they get labeled as IBD, but some of the tests have not been done to find out why the animal has IBD. So we need to figure out why, and that's why looking for parasites, looking at the microbiome, looking for food sensitivities, and looking at hormonal balance, via that Plechner syndrome is important, is what I do. Allison, her tumor was on her right rostral muzzle. The steroids nearly shrunk it completely, and the radiation finished it off. Okay, that's awesome. Well, that's the one with the mast cell. Okay, sorry, bad with names. All right, well, that's good. I would probably also look for the gut on that one, because the large intestine meridian ends up right in kind of in that area in us humans. So same for dogs, kind of right where the like the moist part of the nose would be, kind of right on that side. So I probably would look for that. To make sure that's good. How are hormone levels tested? Are you using T-Touch? Okay, two different questions. How hormone levels are tested through blood most of the time in animals. and humans, they can also be tested in urine and saliva. So that's how I usually test hormones. And then am I using T-Touch? I'm not, but I'm doing a lot of manual therapy, chiropractic, chiropractic neurology, that type of applied neurology. So that's what I do. Barbara, what, if any, tests would you recommend a vet to perform at an annual exam if the dog is not having any problems that I can see? It depends a little bit on the age, but just a regular CVC Chem panel. I usually go for the senior panel because it will include all of the different liver enzymes, and also check for a T4, and then I would also do a fecal and a urine, and then vitamin D test, and then I would also add a biome test once a year, because I have seen dogs that had normal, had no symptoms basically, but their microbiome was pretty much, pretty off. And given that the microbiome has so many functions in the body and is responsible for most everything that's going on, I think it's really important that the microbiome is in good shape. So being proactive on that one would be awesome. Okay, Candy, can a diabetic dog ever come off insulin completely? Well, I think occasionally it has happened, but it depends on how much damage there has been to the pancreas, because if the autoimmune condition has pretty much damaged all of the insulin producing cells, it's not very likely that they're going to just revive. But there's certainly a lot of things that can be done to help support a dog that has insulin, that needs insulin, that is diabetic, to help them need the least amount and also decrease inflammation as much as possible. Kathy, I live in San Diego. How can you treat my dog? Do you work with a vet in San Diego? Yeah. There are definitely some holistic vets in San Diego. There's Dr. Katie Kangas, and there's Dr. Barry Sands. Both of those I like very much. They are doing an awesome job. Eileen, which is the best probiotic for dogs, and can I give them daily? I already am on species appropriate diet. I personally am not a huge fan of probiotics, because probiotics only have a few species of microbes, and if you're feeding the same kind of microbes over and over and over again, then that becomes a bit of a problem, because they may then become overgrown in that animal. And also, if there is an imbalance in the microbiome and you're feeding the wrong side of the imbalance with the probiotic, you're just going to make it worse, and the animal is going to feel worse. And that's why some animals do well with probiotics and some don't. And that also goes for fermented foods. Some animals do great on fermented goat milk and fermented other food, whereas others don't do well at all. So my preference is to actually do fecal transplants, because then we take the entire microbiome and put it into an animal rather than just a few species. And there was a study that was done in humans where they took people who had been on antibiotics and they split them in 3 groups. One group was getting probiotics, one group was getting nothing, and one group was getting fecal transplant. And guess which one actually took the longest to recover their microbiome after the antibiotic use? Was the ones with probiotics, because with the antibiotics it kills off some microbes, and then there's more space, and so if then you give a probiotic, that probiotic will take up space, and then the microbiome doesn't recover as well or as quickly. So yeah, I sort of stopped selling those for the most part. All right, can you program help a vegan dog, 16 years old, has arthritis and spondylosis, to feed meat is not an option? There are a lot of other aspects that are part of the program aside from diet, but I certainly am more, I prefer them to be on the diet that they would eat in the wild, but there's certainly a lot of other information that is essential. Diet is not the only thing. All right. Yeah, the link to sign up, I will email that to you guys. Lori, Sheila, ivermectin, and pyranthal. Yeah, I think, and the plus probably has some praziquantel in it, I would assume. Yeah, okay. What is safe for holistic alternatives to heartworm, flea, and tick medications? Yeah, that's a good question that will take a little bit longer to answer. But I do have a Facebook, actually, I have it on YouTube as well, on my YouTube channel, Creepy Crawly's video, where I go into all of that some more. I think I have it on my website too, actually. Yeah, under events. If you go to events, you will find it. And then I've my 10-year-old duck toddler came to me 5 years ago. I feed him raw, meaty diet and cooked root veggies. My now retired vet who practiced Chinese medicine said he had excessive heat in his stomach, so he is on cooling veggies and raw turkey. Lately, he's been vomiting pieces of bone from turkey neck he eats every morning in the summer. It happens later in the evening. He just had a regular vet checkup and deemed very healthy, especially for his age. He looks great and has lots of energy, but the digestive issue is a concern. I have him on a prebiotic every meal. I would probably check the microbiome as well for that. And then if you have somebody who can do some chiropractic work, to see if the stomach and and the digestive tract are innervated properly, because it almost sounds like things aren't moving quite as well as they should. If he's vomiting up pieces, much later than what he ate, so things are probably not moving quite as well. Lavandula, would you recommend steroid injections for an 11-year-old dog with arthritis and spondylosis? I'm afraid of steroid injections and possible harmful side effects. Well, that very much depends on how serious it is. If somebody, if you're at the point where your animal needs steroid injections for the joints, usually these joints are already in pretty bad shape. So at some point in their lives, when the quality of life is affected greatly, sometimes we just have to do things just to keep their quality of life higher, because in the end, nobody wants to suffer. And so sometimes we have to do things that are maybe, could have potential side effects and could cause some issues. But if it was me, if I had a lot of back pain or a lot of pain somewhere, I would probably rather have less pain and not live as long maybe than, live longer but have pain the whole time. So it's a balancing act, and I can't really quite answer your question, but usually if that is a recommendation that's being made, it means that it's already more advanced. But if you haven't already explored acupuncture, chiropractic work, and there are a lot of herbs and other types of anti-inflammatory supplements that can be also given to support. So if you haven't explored that, I would probably also go down that route and look at that. Laser, pulsed electromagnetic frequencies with the Assisi loop, like Francis of Assisi loop. So those are things that I would explore, certainly. Injections of steroids, usually they're a little bit more localized, and it's not like it's given over and over and over again. So I'm not as concerned about harmful side effects. But anytime you stick something into a joint, there could of course be a little bit of an issue. All right, Sonia, my 9.5-year-old dog has not had a heat cycle since January 21. I worry about pyometra. Can her hormones be checked? Yes, I would talk to your vet about that. And that's interesting because, all animals, or most animals, when they're, most females are neutered at some point. So it's kind of interesting that, maybe she's going into menopause. We don't really know that, too much about menopause in dogs. But certainly, if she's not had a heat cycle for that long, what you could do is you could also just have an ultrasound done just to look at her ovaries and her uterus to see what's going on there, if there's any issue. But certainly hormones can be checked as well. Candy, we changed our diet and started CBD oil. We changed and went to ER with hypoglycemia. So for sure it was a crappy prescription diet. Sorry, I'm kind of losing track here of who that was. Oh, the diabetic. Okay. Yeah, there was a lot that can be done to help regulate blood sugar a little bit better that way. Marsha, my Susie was diagnosed with a mast cell tumor 3 weeks after her 6th birthday. Her holistic vet is also a traditional vet on board, has a traditional vet on board. The recommendation was surgery. The tumor was 1/2 inch from the vulva. I knew surgery was not the way to go. I called to inform them there wouldn't be any slicing and dicing. I was going to go the non-invasive way with CBD. I ordered it 5 separate kinds of mushrooms, etc. And then when hunting the internet, any item that said it treated a mast cell tumor was ordered. So you're one of those who has like a bag full of supplements. But I totally hear you. The tumor started to die within 3 weeks. In 3 weeks, it was dead. Wow, that's awesome. I guess you did a good job. I'm going to get Susie a hair test as soon as resources allow. Wow, that's amazing, Marsha. That's awesome. I'm really happy that happened. Robin, I forgot to ask what you think of phage is like in the prebiotic. Pre4 Pro Animal Biome recommended it for me to try. Yeah, that's when they have a particular overgrowth of certain microbes of the Escherichia shigella kind. I use it then. Otherwise, I don't use it. I missed writing down the link to schedule a meeting. Would it be possible to get it posted in the chat, please? Oh yeah, let me do that real quick. And then I will email you that, guys, that as well. Should have done that sooner. Here we go. Okay. All right, Kit. Very few holistic vets here in Ontario, Canada. I would love, would you know any holistic vets? You could check the AHVMA website, the American Holistic Veterinary Medical Association website. That's ahvma.org. They have a list of veterinarians, so you can see if there's somebody in your area. Thank you, Cassie says. I wish I lived closer to your office. I'm taking many notes. Love the detox summit. Oh, thank you. Yeah, I had fun doing that one. All right, Kit titers, how reliable? How many do you need to do? When is the right time to do them? Yeah, that is, I think I did a Facebook Live on that subject as well, which you could find on my Facebook, on my website, which is odettesuderdvm.com. You can go looking there. Duration of immunity, yeah, same. All right, I think I'm going to stop here because I kept you guys for 2 hours. Thanks for all of you who hung in there so long, and I know a lot of people were still here, and thanks for all the amazing questions. You guys are just really so awesome. I love your enthusiasm and your participation here and all of that. It's just really, really amazing. I will go through the chat and see what else you said, but I will send out an email with the link as well and a little bit more information. And thank you so much for being here and for, helping your animals and being little troublemakers. So anyways, I'm going to leave you guys with that. Have a wonderful, wonderful evening. It was really amazing to be here with you guys. I hope to talk to you, some of you. All right, bye-bye.